Hi students, today let's discuss regarding chickenpox. Chickenpox means it is a highly infectious disease caused by a virus called varicella zoster virus. Okay, so it mainly occurs in young children. That is a high risk group in which you can expect this kind of a contagious disease. It is mainly characterized by crops of vesicular eruptions on the skin, which is the primary most common symptom of or the sign of patients with chickenpox is vesicular eruptions on the skin. Mainly, the clinical course of chickenpox is divided into two stages, such as pre-eruptive stage and eruptive stage. Okay, we can see each one in detail. Pre-eruptive stage means it is mainly characterized by slight fever, mild headache, malaise, anorexia occurring about 24 to 36 hours before the rash begins. So pre-eruptive stage means the name itself denotes that pre means before. Okay, so eruptive means skin eruptions can happen in chickenpox. So before going to happen the skin eruptions, there will be occurrence of fever associated with severe headache, malaise, and anorexia. The duration of these kind of symptoms can be started at 24 to 36 hours before the rash begins. That's why it is called as pre-eruptive stage. Okay. The prodromal period is usually mild in children. When comparing with the eruptive stage, the severity of symptoms will be limited in this stage. Next, eruptive stage, which means the rash appears following fever, centripetal in distribution, which means first appears in the trunk, then comes onto the face, arms, and legs. That's why it is called as centripetal. It will be started at the trunk. Initially, then it can be spread out to the various regions like face, arms, and legs. Okay, so this stage will be happened after the fever and malaise. Okay. ഫീവറും മാലേസ് അങ്ങനത്തെ കോൺസ്റ്റിറ്റ്യൂഷൻ സിംറ്റംസ് കഴിഞ്ഞിട്ടാണ് റാഷ് സ്റ്റാർട്ട് ചെയ്യുന്നത്. ദാറ്റ്സ് വൈ ഇസ് കോൾഡ് ആസ് ഇറപ്റ്റീവ് സ്റ്റേജ്. ഓക്കെ, ദ റാഷ് അഡ്വാൻസസ് ക്വിക്ലി ത്രൂ ദ സ്റ്റേജസ് ഓഫ് മാക്യൂൾ, papule, and vesicle and scab, which means rapid evolutions can be happen. Scabbing begins from 4 to 7 days. എപ്പോഴും initially at the macular formulaയിരിക്കും, then it will be changed into papule, vesicle, and scab formations of rash can be happened in case of an eruptive stage. The vesicles to start with contain clean fluid, but within 24 to 48 hours. Initially the macular formulaയിരിക്കും സ്റ്റാർട്ട് ചെയ്യുന്നത്, ഒരു ബ്ലിസ്റ്റർ ഫോമിൽ സ്റ്റാർട്ട് ചെയ്യും. അതിനുശേഷം അതിനകത്ത് 48 hours കഴിയുമ്പോഴത്തേനും it will contain a clean liquid. Okay, they turn cloudy, are easily broken, and become encrusted. The symptoms last from few days to 2 weeks. When comparing with pre-eruptive stage, the duration of eruptive stage is up to 2 weeks. Okay, so this is a typical picture of a child with chickenpox. So you can see that the skin rashes can be seen on the trunk region and on the arms as well as on the face. Okay, so this is a zoom picture of this rash. You can see this is a blister shape. In that there will be a fluid, clear fluid can be seen within this blister. Okay, the main agent, when we comparing regarding these clinical features or the epidemiological factors of chickenpox, the agent will be varicella zoster virus or VZV. Okay, portal of entry, why this or how this virus can be entered. It will be entered through the respiratory tract through droplets or direct contact with the skin. It can be transmitted either through direct contact with an infected person or through the respiratory tract as the droplets. Okay, the disease primarily occurs in children under the age of 10. That is a risk group or high risk group of people who will have higher chances for getting this infection. The incubation period will be 2 to 3 weeks. In the last session, we had seen what is incubation period or what are the stages of illness, isn't it? So the incubation period of chickenpox will be up to 3 weeks. Single attack gives durable immunity. If a person infects this chickenpox virus once in a life, it will give a lifelong immunity. Okay. Environment. The disease shows a seasonal trend occurring mostly during the first 6 months of the year. Mainly, it can be occurred from the January to up to June. That is a peak time of occurrence of this chickenpox virus. infection. Overcrowding favors transmission because there will be higher chances of direct contact with an infected person. Through that, these infections can be spreaded. Mode of transmission is mainly through the droplet infection, so that the portal of entry can be considered as the respiratory tract, as well as infected articles also spread the infections. Like if you share the linen or the bed linen of an infected person, this infection can be transmitted through that way also. Okay, most of the patients are infected by face-to-face contact. Incubation period is 14 to 16 days or up to 3 weeks. Investigation and diagnosis, history collection. So we can collect history regarding if whether the patient had any history of or exposure to this kind of infection from their family members or not. In that aspect, we can collect the history. Okay, or if the patient came from another region, or you can inquire regarding whether any kind of infection in that region. Okay, that's all about the history collection. And we can associate, we can collect the history regarding whether the patient had any fever or headache before getting the occurrence or before the appearance of this rash. Okay, then physical examination, skin rashes with itching, low-grade fever. So after collecting adequate history from the patient, you can assess the physical examination findings, like patient may be having a skin rashes with which will be having an appearance of a blister. Okay, so the skin rashes can be seen first of all in the on the trunk, and it will be spreaded up to the face as well as on the arms or lower extremities. So the rashes can be assessed. Okay, the low-grade fever associated with other kinds like headache can be seen, severe malaise can be there. So these kind of symptoms we should identify. Then examine the scraping of the skin lesions under microscope. Through that we can assess the or we can confirm the diagnosis. Okay, then management. How we can manage this chickenpox? Mainly the symptomatic management is very much effective for controlling this infection. For that, we can use acetaminophen can be used to decrease the fever and headache. So patient will be having severe form of headache associated with fever. So it can be managed with proper antipyretic therapy as well as analgesics. Okay, then diphenhydramine or Benadryl or other antihistamines can be used to control the itching, because due to the eruption of or due to the appearance of the rash, sometimes patient may be having severe itching. Okay, so to control this itching, you can manage with some kind of antihistamines. അല്ലെങ്കിൽ നമ്മൾ ഈ ചൊറിയുന്നതിനോടൊപ്പം തന്നെ ഈ ബ്ലിസ്റ്റേഴ്സ് പൊട്ടാൻ സാധ്യതയുണ്ട്. പൊട്ടുന്നതനുസരിച്ച് ഈ ഫ്ലൂയിഡ് ലീക്ക് ആവുന്നു. ഓൾമോസ്റ്റ് എവിടെയൊക്കെയാണ് ആ ഫ്ലൂയിഡ് എൻ്റർ ചെയ്യുന്നത് അവിടെയൊക്കെയും വീണ്ടും സ്കിൻ ഇറപ്ഷൻസ് ഉണ്ടാവാനുള്ള സാധ്യത കൂടുതലാണ്. സോ ആസ് possible, we should educate the person not to scratch the or not try to itch the skin. Then we can use some kind of varicella vaccine. It may be used as a medication for someone who has been exposed but is not yet showing symptoms. ഒരു ഫാമിലിയിലെ പേഷ്യന്റിന്റെ ഫാമിലി മെമ്പേഴ്സിന് ആർക്കെങ്കിലും ഇൻഫെക്ഷൻ വന്നിട്ടുണ്ടെങ്കിൽ as a prophylactic treatment we can get this varicella vaccine. It should be given within 72 hours and possibly up to 120 hours after chickenpox exposure. Chickenpox exposure ഉണ്ടെന്ന് മനസ്സിലാക്കിയിട്ടുണ്ടെങ്കിൽ within 72 hours or within 120 hours the person should get the vaccine. Okay, then vaccine may prevent or significantly reduce symptoms in greater than 90% of cases if given within 3 days of exposure. Exposure ആയതിനു ശേഷം 3 ദിവസത്തിനുള്ളിൽ തന്നെ വാക്സിൻ കൊടുക്കുകയാണെങ്കിൽ we can prevent or we can control these symptoms. Then the common medicine that we can use during chickenpox period is acecloprid. Okay, so it is a drug of choice for varicella infection in children 2 to 16 years of age. The oral dosage will be 20 milligram per kg in 4 times or 6 divided doses for 5 days. That is the dosage of acecloprid. If you are using this kind of medicine in children up to the age of 16 years, we can given at an oral dose of 20 mg per kg 4 times a day, or the duration of up to 6 hours gap namakku kodukam. Up to 5 days this treatment can be continued. Then adolescents and adults will be given at a dose of 800 mg 5 times a day. Okay, so the dosage is very, very important. It should not be changed. Okay, then varicella zoster immunoglobulin. It is given within 72 hours of exposure, has been recommended for prevention in doses 1.25 to 5 ml given as intramuscular route. So it is also help the person to get protection from this infection. It can prevent or reduce the symptoms after exposure. It is very much costly, so we can't afford. Many of the persons who cannot afford this kind of immunoglobulin due to the increased cost. It may lessen the severity of the disease when given with 24 hours after the rash first appears. Even though the rash can appear on the skin, this after the administration of this immunoglobulin will give a reduction of the severity of the symptoms. Okay. Then regarding the nursing management, the treatment of skin discomfort and itching is a cold bath every 3 to 4 hours for the first few days. So we should encourage the patient to take bath during the initial stages of the disease to control the itching as well as to get a comfortable or to get relief from this discomfort. We can encourage the patient to take a bath. Add 4 tablespoons of baking soda per tub of water. The itchy areas can be massaged with an ice cube. It will also give some kind of relief. Frequent odd metal baths can decrease the itching associated with chickenpox. Soothing lotions and moisturizers such as calamine lotion can be applied to the rash. നമ്മുടെ മെയിൻ ആയിട്ട് പേഷ്യന്റ് കംപ്ലൈന്റ് എന്ന് പറയുമ്പോൾ സ്കിൻ റാഷസ് എലോങ് വിത്ത് ഇച്ചിങ് ആയിരിക്കും. സോ ഇച്ചിങ് കൺട്രോൾ ചെയ്യുന്ന മെഷേഴ്സ് ആയിരിക്കും കൂടുതലായിട്ട് എടുക്കുന്നത്. ലൈക്ക് കെലാമിൻ ലോഷൻ അപ്ലൈ ചെയ്ത് നമുക്ക് ആ ഒരു ഇച്ചിങ് സെൻസേഷൻസ് കുറയ്ക്കാനായിട്ട് സാധിക്കും. കീപ് ദ ഫിംഗർ നെയിൽസ് ട്രിം ഷോർട്ട് ബിക്കോസ് സ്ക്രാച്ചിങ് ബ്ലിസ്റ്റേഴ്സ് മേ കോസ് ദം ടു ബി ഇൻഫെക്റ്റഡ്. ഓക്കെ, അപ്പോൾ പേഷ്യന്റിനോട് നമ്മൾ കട്ട് ഷോട്ട് ചെയ്യുക, നെയിൽസ് കട്ട് ഷോട്ട് ചെയ്യുക, അല്ലെങ്കിൽ കൂടുതൽ നമ്മൾ സ്ക്രാച്ചിങ് അല്ലെങ്കിൽ ചൊറിയാൻ ശ്രമിക്കുന്ന സമയത്തിനിടയ്ക്ക് ബ്ലിസ്റ്റേഴ്സ് പൊട്ടാൻ സാധ്യതയുണ്ട്. അങ്ങനെയാണ് ഫ്ലൂയിഡ് ലീക്ക് ചെയ്ത് വീണ്ടും ഇൻഫെക്ഷൻസ് വരാനുള്ള സാധ്യതയുണ്ട്. Then, encourage to drink cold fluids. A soft, bland diet, avoiding salty foods and citrus fruits is good. കാരണം എപ്പോഴും വായിക്കകത്തൊക്കെ ആണെങ്കിലും ഈ റാഷസ് ഉണ്ടാവാൻ ചാൻസ് ഉണ്ട്. അപ്പൊ പേഷ്യന്റിന് ഒത്തിരി സ്പൈസി ഫുഡ്സ് ഒന്നും എടുക്കാനായിട്ട് സാധിക്കത്തില്ല. ഇൻ ദാറ്റ് സിറ്റുവേഷൻസ് വി കൻ എൻകറേജ് ദ പേഷ്യന്റ് ടേക്ക് എ സോഫ്റ്റ് ആൻഡ് bland diet food items. Okay, the isolation of patient is very important to prevent the transmission of this chickenpox virus. So, as it is an airborne infection, we should isolate the patient. Private room should be provided and respiratory isolation is recommended. Okay, then instruct patient to avoid touching or scratching the rash to prevent the spread. ഇപ്പോഴും സ്ക്രാച്ച് ചെയ്യുന്നത് മാക്സിമം ഒഴിവാക്കാനായിട്ട് പറയണം. Encourage the patient to wear loose fitting cotton cloths or keep the infants unclothed for a while. ഇപ്പോഴും അഡൽട്ടിനാണ് ഈ ഇൻഫെക്ഷൻ വരുന്നതെങ്കിൽ തീർച്ചയായിട്ടും നമ്മുടെ ലൂസ് ഫിറ്റിംഗ് ആയിട്ടുള്ള കോട്ടൺ ക്ലോത്ത്സ് യൂസ് ചെയ്യാൻ പറ്റണം. അല്ലെങ്കിൽ അത് സ്കിന്നോട് ഒത്തിരി അറ്റാച്ച്ഡ് ആവാനുള്ള സാധ്യത ഉണ്ട്. അപ്പോൾ കൂടുതലും ഈ ബ്ലിസ്റ്റേഴ്സോട് അറ്റാച്ച് ചെയ്യുമ്പോഴത്തേനും വീണ്ടും അത് പൊട്ടാനുള്ള സാധ്യതയുണ്ട്. Keep the patient in a clean environment because heat, humidity and sweat may increase itching. എപ്പോഴും നമ്മുടെ സ്കിൻ ക്ലീൻ ആയിട്ട് കീപ്പ് ചെയ്യാനായിട്ട് പേഷ്യനോട് എൻകറേജ് ചെയ്യുക. അവോയ്ഡ് സ്ട്രോങ് ഫ്ലേവേഴ്സ് ആൻഡ് ഫ്രൈഡ് സ്റ്റഫ്, അവോയ്ഡ് ബ്ലാൻഡ് ഐറ്റം. എപ്പോഴും ഫ്രൈഡ് ഫുഡ് ഐറ്റംസ് അവോയ്ഡ് ചെയ്യാനായിട്ട് പറയണം. Okay, that's all about chickenpox. So in this session we had seen regarding what is chickenpox. It is a contagious disease that is mainly caused by varicella zoster virus, and it is a mode of transmission is to the droplet nuclei. So to prevent this kind of infection, we should isolate the patient as early as possible and to educate the patient to do not touch the rash because it can cause severe itching as well as it will lead to the transmission of this infection to the other persons also. Okay, so I hope you got an idea regarding this condition. So if you have any doubt, you can contact me. Okay, thank you.